Ooh, I don't even know how to do this anymore. Hey guys, my name is Shadi Becker. Welcome to or welcome back to my channel. I am a graduate entry medical student here at the University of Cambridge, and it just so happens that I'm interested, or currently interested in, obstetrics and gynecology. So all things to do with women, all things to do with fertility, all things to do with pregnancies. I'm still planning on making videos on the University of Cambridge and applications and all of those things, but I do want to start making videos on things that I am personally interested in. Without further ado, my first video. Today we're going to be talking about vaginas. So in today's video, we're particularly going to be talking about vaginal itch, how to self-diagnose, and how to self-treat itch. Vaginal itch is actually surprisingly common, and most women between the ages of 20 and 40 years old will have experienced it at some point in their life. If you're experiencing itching, burning, odors, a change in discharge, these things can happen for a variety of reasons, but most of the time there's actually some sort of bacterial, fungal or parasitic basis to these things. And in this video we're going to break down the three main types of infections that you can have that can be the reason for your vaginal itch or burning or discomfort or whatever it is. We're going to get into it. So the three main type of diagnoses that we're going to be talking about today are thrush, bacterial vaginosis, also commonly known as BV, and trichomoniasis. So before we dive into what is abnormal and how to tell that something abnormal is going on down there, we need to understand what normal is. A normal vagina is a vagina that is actually slightly acidic, so we expect a vagina to be around the pH of 4.4, which, to put into colloquial context, is a little bit more acidic than acidic rain. We expect that to be discharge because everyone describes the vagina to be a self-cleaning machine, but that's really what it is. Thick liquid that kind of travels down your vaginal tract and carries along with it all of the things that shouldn't really be there. So that's why we produce discharge, to put very simply. But aside from this, our vagina actually hosts a colony of bacteria, and this is going to be really important when it comes to some of the infections later on. So a normal vagina should have a colony of bacteria. Hold that thought. So now to get onto vaginal infections a little bit. So if you have a vaginal infection, you would have probably noticed some kind of change in discharge, some kind of change in the odor of your discharge. You might have had burning while you're urinating, which is called dysuria or painful urination, and just burning and itching in general. So it's going to be important for you to note down what symptoms you're experiencing, which is going to be helpful in a diagnosis. But actually, to come back to the idea of pH, we are going to implement the pH of your vagina alongside the symptoms that you're experiencing to help come to a more accurate diagnosis. So right now you might be thinking, okay, I understand that a normal vagina is at pH 4.4 and that the pH might change if I get an infection, but how do I test for a pH? Well, Boots, not sponsored, Boots has actually made a woman's intimate self-test kit. This kit comes with a little stick which can be inserted intravaginally, so inside of your vagina, and then it will show up with a colour, so nothing mathsy, no numbers. And then at the back of the test kit there are different colours that indicate what pH it is, and also conveniently categorize it into different diagnoses. So in order to come up with an accurate diagnosis, you're going to want to take note of three main things. One, the sensations you're feeling, so the symptoms that you can feel. The second is going to be a change in discharge that you're noticing, and whether this discharge comes with any particular smells. And three is the pH that you can test using this pH kit. So now I'm going to dive into the portion of the video where we're going to discuss the three diagnoses that I mentioned before, and what symptoms you would expect, what discharge you would expect, and then lastly what pH you would expect. We're going to talk a little bit about the science, not too much because this is what I'm interested in, the science of these diagnoses, why they happen, and then we're going to finally talk about how to combat them, and hopefully all of it together should make sense. So first let's talk about one of the most commonly known and commonly occurring vaginal infections, thrush. So if you're experiencing thrush, the sensations that you might feel might be itching, burning, and discomfort when you're trying to pee. when it comes to your pH, the pH will actually be the normal acidic pH we expect from a vagina, so around 4.4. But again, you can use the test kit to test for whether your pH is normal or off balance. When it comes to the discharge, you might expect the discharge to have the consistency of cottage cheese. So I'm going to show you what that looks like with my homemade discharge. So it's usually quite clumpy, thick, and resembles cottage cheese. This looks a little bit yellow. You might expect it to look a little bit more white. So thrush is a fungal infection. This means that it's produced by fungi. As I said before, your vagina should have a normal bacterial colony. And when this bacterial colony, for one reason or another, is reduced, it allows fungus or fungi to thrive in that environment. So it's kind of a battle or a yin-yang thing between fungus and between bacteria. If there are too few bacteria, that means the fungus can grow, and eventually this can give you an infection which will produce those unpleasant symptoms. So what then causes this bacterial colony to be reduced for one reason or another? So commonly using soaps, using perfumed soaps, and having had a course of antibiotic treatment. So if you're treating an infection somewhere else in your body, right now I'm taking amoxicillin, which is a type of antibacterial. I might then expect that after I finish my course of amoxicillin that I develop thrush, because that antibacterial does not know that it needs to attack the bacteria in my gum. All it knows is I'm going to be doing my antibacterial properties everywhere in your body, which includes the vagina where there is a host of bacteria. So my bacterial colony in my vagina might be expected to go down because I'm taking antibiotics right now, which means that the fungi can thrive and produce thrush. The last thing I want to address here is that a lot of people have this perception that if you have acquired some sort of vaginal infection, that is an indication of your hygiene and your cleanliness. When it comes to thrush, I actually like to call this the hygienic paradox, because actually over showering and over cleaning and doing a lot to get rid of the bacteria in your vagina is exactly what gives rise to thrush. So actually being too clean can give you thrush, not the opposite. So thrush isn't this scary thing that is a sexually transmitted disease and only happens to dirty people. So if you ever hear it on the streets, the hygienic paradox, it came from Dr. To Be, hopefully, if I finish this course, Shirley Becker. Now we've spoken about what thrush is, what symptoms you would expect. Now let's talk about how to treat it. So thankfully, the treatment for thrush is an over-the-counter treatment, so super accessible. You can get it from Tesco, you can get it from Sainsbury's, you can get it from Superdrug, Boots, anywhere really sells thrush treatment. So thrush treatment usually is the type of cream that you can use externally on the labia minora, but also some sort of liquid that you can insert within your vagina. This type of cream contains a drug called an azole drug, and an azole drug has antifungal properties. A fungi, like every sort of cell, microbe, whatever, is surrounded by a layer called a membrane. Azole drug disturbs the integrity of this membrane, so essentially doesn't allow this membrane to be and do what it needs to do, which is protect the fungus and allow it to grow. So once the membrane has been disrupted, the fungal is inhibited from growing any further, and that is how you destroy the fungal colony in your vagina if you have acquired thrush. You can administer it yourself, and it's only one single dose that you insert inside your vagina, and then a cream that you can use on your labia minora. So the next diagnosis that we're going to discuss is bacterial vaginosis, also commonly known as BV. So if you're experiencing bacterial vaginosis, your symptoms and your pH can be expected to be different than thrush, which is what we just discussed. So in terms of sensations, you can experience the itching. In terms of the pH, we expect the pH to be more basic, so that means higher than 4.4, which is a normal pH for a vagina. The discharge that you can expect will be milky and white, but characteristically will have a fishy odor to it. Whereas in thrush, we would expect odorless discharge that was clumpy and resembles cottage cheese. So again, I've got my homemade discharge. So this is a lot more runny. It should have a fishy odor to it. So again, with the pH self-testing kit. You can test for the pH. Along with these symptoms, you can be pretty confident that it's bacterial vaginosis that you're experiencing. As it implies in the name, it's a bacterial infection. So thrush was an infection caused by fungus. This is an infection caused by bacteria. If we look at our normal bacteria again, there is a particular strain of bacteria that thrives in an anaerobic environment and produces lactic acid. This lactic acid then contributes to the pH of our vaginas. If for some reason there is a change in the environment of your vagina, which means that the number of this lactic acid producing bacteria or strain of bacteria is reduced in proportion to other strains, it will cause a pH change that will shift it from acidic, because the bacteria produce lactic acid, to something a little bit more basic or alkaline. This is then what gives rise to the symptoms, including the itching or burning sensation, the change in discharge, and the fishy odor smell. BV in of itself is not considered or classified as an STI. It can be introduced by sex, especially if you're having sex with a new partner, because this can introduce a bacteria that isn't the lactic acid producing bacteria that we should normally have, and it increase the colony of this alternative bacteria and decrease the colony of the lactic acid producing bacteria, which then causes the change in pH, which then causes all of the symptoms. Again, when it comes to bacterial vaginosis, the treatment for this is super accessible. So the treatment for a bacterial infection, just like most generally, will be an antibacterial given to you in tablet form or in cream form, so I guess that just depends on your preference. But when you take an antibacterial treatment, you just have to make sure to finish the course off entirely to prevent a resistant strain from growing and pervading, because then you're in real heat, you know? If you think BV is a problem, try and get resistant bacteria down there. Like, that's a bigger problem. That is it. That's it for bacterial vaginosis. Final and the last treatment that we're going to be discussing today is trichomoniasis. So trichomoniasis, I think, is less commonly known and heard of, or I certainly didn't know much about it before I became really interested in all of these things. If you're experiencing trichomoniasis, you might be having discomfort, itching, burning again, but characteristically, your discharge will be more yellow and will still have this fishy odor to it. So whereas with bacterial vaginosis the discharge was white and milky, this type of discharge when it comes to trichomoniasis is more yellow. And again, I will show you my homemade discharge, which should give you an idea of what you're looking for. As you can see, that's more yellow. It will have a fishy smell to it. So if we now discuss a bit of the scientific basis behind trichomoniasis, trichomoniasis is an STI, is classified as an STI, and it's a parasitic infection. So it's caused by parasites. This parasite is commonly found in the vaginal tract of women who have the infection, or in the urethral tract of men who have the infection. So when two people have sex, the urethra of a man will make contact with the vaginal tract of a woman. And this is why it's considered an STI, because it's purely because of sexual contact that these parasites can be transferred between two people. This example was applicable to heterosexual sex. When it comes to the treatment of trichomoniasis, it's actually prescription only treatment, which means that you should be contacting your doctor to acquire this treatment. However, this treatment does fall under the online doctor prescriptions that you can get. So you can get this treatment via an online doctor. So Superdrug will have them via the online doctor platform, and there might be some others as well. Trichomoniasis is treated with a specific type of antibiotic, and this specific antibiotic is called metronidazole. The mechanism of action for this drug is actually not that well understood. We do know that it has antiparasitic properties, which is why, although it's an antibacterial, it's effective against trichomoniasis, which is a parasitic infection. If you are experiencing the yellowish greenish discharge that smells fishy, and you're getting itching and burning, and you suspect that you have or you might have trichomoniasis, then that's the appropriate treatment for you. And that brings us to the end of this video. So in this video we have discussed vaginal itch, we've discussed the 3 most common infections that can be the basis of a vaginal itch, we've discussed how you can look at the sensational symptoms you're experiencing, the discharge that you might be getting, and the pH that you should expect for each of these 3 diagnoses, and what treatments work for them, and kind of the scientific or a flavor of the scientific basis behind all of these infections. So I hope that was useful for you. I genuinely enjoyed talking about this, and there are lots of other things to do with obstetrics and gynecology that I want to discuss. I will have links below to everything that I've mentioned today that you can purchase, including the Women's Intimate Self-Test Kit, the treatments that I've mentioned, and that should all be found in the description. If you enjoyed it, like, comment, and other than that, I will hopefully see you soon. Goodbye. Thank you for watching.